I now recognize Mr. Yakym.
Thank you, Mr. Chairman, for holding this hearing today and for our witnesses for being here today on such an important topic. Ensuring our seniors have access to quality health care is an important issue to the Hoosiers and the seniors that I represent. Medicare Advantage, also known as MA, has been a strong success for America's seniors as we've seen substantial growth in the program over the last 2 decades. In 2007, 19% of Medicare beneficiaries chose MA plans, and now that's up to 54%. MA enrollees tend to have better outcomes when compared to their peers on traditional Medicare. Most notably, they have 70% fewer hospital readmissions and 25% fewer inpatient stays. But no matter how successful a program is, I think in order to be good stewards of taxpayer dollars, we must continually look to make programs more effective and more efficient. I think it's equally important that we keep all stakeholders engaged at the discussion table, especially seniors and healthcare providers as we strive for program improvement. I regularly hear from healthcare providers in my district that they struggle with the administrative burdens associated with Medicare Advantage, in particular about prior authorizations, when a provider must receive authorization from an insurance company before service may be administered. I certainly join my colleagues on both sides of the aisle today with concerns about excessive prior authorizations. Mr. Basel, can you talk about the impact prior authorizations have on healthcare providers and the seniors they seek to serve?
So it's all about where is that sweet spot, because there is a very good case to be made for managing care. So you don't want no floodgate to be in there. So let's say a patient comes in with abdominal pain, and I don't think there's any concerning symptoms. I think that they're going to get better in a couple days, but they're really worried and they want a CT. You know, if there's no care, then the path of least resistance might be, sure, fine, you can have a CT. But if there's a little bit of prior authorization there, that enables the conversation about, you know, I just know that the payer is not going to approve this. Let's wait a couple days, see how things go, maybe start with a plain film. We actually have a better clinical outcome. We're not exposing the patient to radiation, and there's actually better care in that situation. And so there is a sweet spot there, but it's when that becomes excessive, and I've got a patient I am worried about that I can't get that necessary CT for, what that becomes. And so this is not a black and white issue. This is a where in that spectrum is the sweet spot.
Thank you. And Mr. Basel, you spent several years working with rural healthcare providers. Can you share some of the unique challenges prior authorizations pose in these rural communities?
Probably one of the biggest challenges in our rural communities, you know, in my big tertiary care center, you know, I've got a whole fleet of people that I train up on this, and they get really good at prior authorizations and denials and peer-to-peers and all of this, and they become experts in this. In my rural settings, you know, my director of nursing is also the quality director, is also the HR director. Everybody wears multiple hats in these smaller hospitals, and they can't be an expert in authorizations and denials and stuff too. And so we face an uphill battle. We try to support them as much centrally as we can, but it's a whole different ballgame when you can't do this all day, every day, like some of our larger facilities do.
And what do you see as some of the biggest opportunities to improve the prior authorization process?
Streamline it. I mean, again, there's tools out there that there's no reason that, you know, 70% of these are getting overturned on denial. They should be able to tell which one of these ahead of time are going to make it through. And if it's a dotting the I or crossing the T things, that should be able to get caught, you know, through some of the technology tools that we have.
Thank you, Mr. Basel. And Mr. Chairman, with that, I yield back.